before each ear piercing, you should sanitize the moving parts of the ear piercing instrument. There is a difference between sanitation and sterilization. Sanitation is recommended on anything that can only touch the person's skin. So I'm going to sanitize the instrument. It's only touching the skin. Sterilization is required on anything that's going to break the skin. So these ear piercing studs, whichever style she chooses from this display, will be in packages like this because they've all been pre-sterilized in a gas heat. These are the only things you should use to pierce the ear. Now what you need to check for on your client before you clean their ears, you might feel lumps or knots if you've had them pierced before. That's called scar tissue. If you do ear piercing, this happens a lot. People come in, they ask you to reopen their holes because they've closed previously, but they want them reopened in the exact same spot. If you feel a lump, that scar tissue, you pierce it, you break it, it gets bigger and bigger each time. So if there's a lump or knot there, the hole's closed, just pierce directly next to it, to one side or the other. If there isn't any scar tissue, then that's okay. You can pierce it in the same spot, but always make sure you check for that first. The most important thing is cleaning the ear. I'm going to clean up the ears with alcohol before I pierce them. Alcohol takes oils off your skin. What alcohol does not do is it doesn't promote healing because alcohol tends to over dry your skin. It's too aggressive. So instead of alcohol, when we're done, I'm going to give her this tube of ear care gel. This is an antiseptic. An antiseptic is very mild. It doesn't over dry the skin. This comes in the ear piercing kits. If I didn't have this for her, I could still pierce her ears, but I tell her to go to the drugstore and buy any type of a general antiseptic. One of the best ones you can buy, believe it or not, is saline solution. The stuff for your contact lenses, you can use that. It's very mild. I'm a big believer in Neosporin. Neosporin is an antibiotic, however. An antibiotic is designed to kill an infection, and antiseptic's designed to prevent an infection. So they're kind of opposite of one another. If the client can't get those, the next best thing would be just simply soap and water. Dial soap is your best bet because it is antibacterial. But alcohol is not a good thing to use. It does over dry the skin. The key is you have to let the client know they need to clean each hole you pierce at least 2 times a day. Once in the morning, once in the evening, for the full 6 weeks, irregardless of how their ears feel. And also if you're active, especially in the summertime, ear piercing picks up in popularity, then you want to tell them to clean them because you perspire more. When perspiration gets in the newly pierced holes, it raises the chance of infection. That's when you want to tell them to clean them more than twice a day. The last thing that's important to tell them is piercing the top of the ear. You can pierce up here. This is called the cartilage, the gristle, but you should let the client know, and Kelly's crazy enough to do this, I guess, but let them know this is soft bone tissue. Technically, it's like breaking or chipping bone when you're piercing this cartilage. It can be a lot more painful than piercing down here the earlobe. This is soft skin tissue, and it can take a lot longer time to heal. I have people tell me, I'm not exaggerating this, you guys, they pierce their ear in the cartilage. Some people say it takes them almost a year before it starts to feel better when they pierce it up here, and it hurts. They lay on it, they hit it with a telephone. It can be very painful, so you want to make sure you let them know that. The nose, good question. The nose is the exact same thing. This is the exact same thing as cartilage. The nose is the exact same thing as cartilage. The ear piercing instrument, the release form only covers you on the ear. People take that gun, they pierce whatever, and it's not a good idea. Because body piercing should be pierced with hollow needles, plain and simple. You should not use the ear piercing instrument. But the advantage the instrument has over the hollow needle, it doesn't cause bleeding. And the reason it doesn't cause bleeding, when the ear piercing instrument pierces your ear, it's kind of like piercing a balloon that never bursts. The training stud goes through the ear, the skin tissue wraps around the earring post, it seals itself immediately. Some of you guys, I'm sure, have had body parts pierced. They'll take a needle, it's hollow in the center, they push it through the body part you want pierced, it takes a small layer of skin out, and then they immediately replace it with the tongue ring, the navel ring. The ring they replace it with, if the post is too small for the hole they just made with that hollow needle, it doesn't seal. When it doesn't seal, you guys, that's when it starts to bleed. So be careful. If you're going to have body parts pierced, that's fine. I'm not throwing that under the bus. I'm just saying, find somebody with a lot of experience in that. Because the function of a body piercing is done by the person's hand. The function of the ear piercing, you guys are going to see now in a minute, is not done by my hand, it's done by the instrument. Big difference between the two. So, a bacteria called Pseudomonas, it grows in swimming pools, jacuzzis, on cats and dogs. If you're piercing the cartilage, you want to stay out of the jacuzzi with George Clooney. Okay, the sizes of the earrings. They do come, when you guys ask that, they come in 3 different sizes: large, regular, and mini. So the instruments have these little adapters in them to fit the different sizes, and they have these little clips you can use to change them. You take this clip, set it onto the instrument, pull the plunger back, you can remove the little adapter. This is set to go for a regular size earring. There's one for a large size and the mini size. We're going to use the mini size earring. So I put the mini size clip in, I pull the trigger back, it's ready to load, or you can change these with your fingers. Just simply pull the plunger back, you can take the little adapter out with your fingers. If you use your fingers to change the adapter, what should you do to the instrument, remember? Sanitize it. Very good. Sanitize it. Then, what can cause an infection when somebody uses an ear piercing instrument to pierce your ear? When they open these packages and they remove the sterilized earrings, what they'll do is they will touch one or both of the little points that stick out the back. You guys, if you touch the points, the earrings are no longer sterile. You can touch the backs or the heads of the studs, but not the points. You can't sterilize your hands. Even gloves is not considered sterilization. Now, when you load the instrument, hold the instrument level, take the front of the ear piercing instrument, slide the little back into the front, straight up and down, very gently until it stops. Pull them apart from one another. Take the mount, turn it upside down, put the earring style on the hole or the adapter, and gently turn it and pull it straight up at the same time. You take I'm going to mark her ear off with this surgical marker. This is the exact same thing a surgeon uses when they mark your body for surgery. It's made out of vegetable oil. People tell me they get their ears marked and have them pierced in some of these stores out there with pens, magic markers, what do you call those things? Sharpies. That can be dangerous because some of those things have lead in the ink. You get lead in your bloodstream, you guys, you could get lead poisoning. So what I'm going to do is pierce the ear, and then I'm going to put a couple drops of this ear care solution on. This is optional, you don't have to use this. This has benzalkonium chloride in it, but it'll soothe it a little bit, and you'll see that. All I'm going to do is take the side of Kelly's ear, pull the ear, put the ear piercing instrument up, keep it level, 1, 2, 3. Pierce the ear, pull the gun straight down. She's alive, that's always a good sign. And now I'm just going to put a couple drops of this on it, just makes it feel a bit better. Does it feel better? Say yes. Tell me yes.
Nothing happened?
Tell me yes.
Nothing? No pain? Nothing?
Yeah. I mean, it hurts, but yeah, it's fine. Yeah.
Now I'm going to give the gel to Kelly, you guys. How many times a day should she use this? Twice a day. Oh, and also babies, newborn babies, especially in beauty salons. I'm going to stereotype a little, but you have a lot of women that go into salons. If they know you do ear piercing, some of them are going to ask you to pierce their newborn babies. They simply want to get it over with. Before you do that, always ask the parent if the baby has had their tetanus shot. When a baby's born, it has its mother's immunities from the mother's womb to fight infection. But as the baby gets older, 4 or 5 weeks old, the immunities start to wear down. I think it's 8 weeks. They're supposed to have what they call a DPT shot. It stands for diphtheria, pertussis, tetanus. So, you want to make sure they've had that. Any questions, you guys?